The emotional freedom technique, or EFT tapping. What are the risks? Studies indicate that there are very few, if any, adverse side effects when EFT is used properly, Stapleton says. That is, when EFT is done with a trained therapist, she adds. There are also few, if any, risks associated with standard EFT tapping for most healthy people who turn to this self-administered approach to manage everyday stressors. However, if someone with PTSD or past trauma discovers EFT tapping on their own and tries tapping along with a tutorial, they may become distressed as they remember past events without the guidance of a licensed healthcare professional. The risks are emotional flooding and re-traumatization, Church says. Re-traumatization is a return of trauma-related thoughts and feelings, which cause you to relive the events that led to your PTSD, according to the Substance Abuse and Mental Health Services Administration. Who might want to try and avoid EFT tapping? EFT tapping is generally considered a safe and effective therapy for many people. You can use it to help reduce everyday stress and anxiety, improve mental focus at work and in sports, get a handle on food cravings, and more. It can also be used in a clinical setting with a licensed practitioner to help address and resolve PTSD and trauma. The risks typically come with doing EFT tapping on your own versus working with a trained professional. We recommend that people use EFT on their own for everyday stress. So if you're late for a job interview or you have too much work to do, Church says. However, we don't recommend that people who are traumatized try this on their own. If you try tapping on your own and you begin to feel overwhelmed by the feelings or thoughts that arise, or you sense that your issues are too complex to address on your own, consult an experienced EFT practitioner, advises EFT International. Access to EFT tapping. Technically, you can access standard EFT tapping anytime, anywhere. It's a simple method to learn, and self-administered standard EFT sessions take only a few minutes. You can learn more about standard EFT tapping for free by downloading the app like the Tapping Solution, reviewing an online tutorial like the ones offered by EFT Universe, or watching informational videos from licensed healthcare providers like What is EFT Tapping? However, people with addiction, PTSD, or other trauma must work with a healthcare professional who's certified in clinical EFT, Church says. You can find a clinical EFT practitioner through EFT International or EFT Universe. Clinical EFT tapping is sometimes covered by insurance, so check with your insurance provider before undergoing this therapy. Tips for getting started with tapping. If you're interested in trying EFT tapping for everyday stress relief, you can start tapping with an app or an online tutorial. There are countless online tapping tutorials and sessions you can try. Often you can find tapping sessions geared towards a specific goal or concern, such as stress, focus, fear, and relationships. Both the Tapping Solution and EFT Universe offer many free resources to get you started. You can perform a brief tapping session before work meetings or presentations, after an argument with your partner or friend, or when you need to cultivate focus. If you want to use EFT tapping for PTSD or trauma, speak with your healthcare provider. You can also find a clinical EFT practitioner through EFT International or EFT Universe. What to expect before, during, and after EFT tapping. If you're using standard EFT tapping for general stress relief or improved focus in life, You may only need to work with the tapping app until you get the hang of the technique. From there, you can continue using the app or try tapping without guidance. When you start your tapping session, you'll focus on negative emotions and unresolved issues. But as you tap through your acupoints, you may notice that your thoughts become more positive and that you start to relax and feel better. The approach to using clinical EFT tapping for PTSD or trauma looks a bit different. For starters, you'll be working with a certified clinical EFT practitioner. This person will likely ask you to recall details of a traumatizing event as vividly as possible, and have you pair this memory with a neutral statement. While you share the statement, you'll tap specific acupoints. According to the clinical guidelines, a typical statement might read, "Even though I vividly recall the horror of the bomb blast, I deeply and completely accept myself." This statement is accompanied by a tap on the acupoint on the side of the hand. From there, you'll gently tap the acupoints at the start of the eyebrow, side of the eye, under the nose, under the lips, an inch under the collarbone, under the arm, and top of the head with 2 fingers per the guidelines. As you tap, you'll say a shortened version of your earlier statement. Your therapist may ask you to rate the intensity of the traumatic event at various points during the session. These ratings help your therapist determine the next step in your treatment. How many sessions you'll need may depend on the severity of your condition. However, clinical guidelines recommend 10 sessions for people with PTSD. There are online, app, and telemedicine options for clinical EFT. However, in-person sessions were found to reduce PTSD symptoms 91% versus telephone sessions that reduce symptoms by 67%, according to a review and survey published in 2017 in the Permanente Journal.